So, am I audible to all? I can see the chats in here. So, very warm welcome to all those who've joined for my YouTube live tonight. I know this was on a short notice, so बहुत ज़्यादा मैं सब quick questions पहले से नहीं ले पाया. But yes, some interesting things and which I wanted to share with you. Uh, First of all, thank you all क्योंकि we crossed more than 3.5 lakh subscribers on YouTube, and all of you have been asking so many questions, queries that we've tried to answer, but now the numbers are still increasing and काफी सारे questions के answers हम नहीं दे पा रहे हैं. I know we receive more than 3,000 comments every month. It becomes difficult for me personally to be helping and solving your queries. And yes, YouTube is a platform where we are restricted by certain community guidelines which YouTube has, so that हम किसी को भी exact diagnosis, exact medicines is something which we cannot suggest on a public platform. These are some restrictions जो channel पे होते हैं. And today I want to share something interesting with you. Varicose veins is such a common problem, and many of you have met me, thanked me for all the information, the knowledge that I have been sharing to help so many people. Many of you who have never met me or might not even meet me again. But I understand that varicose veins is one of the main common problems that so many of you are facing. The knowledge about this, the authentic information is often missing. Instagram, if आप में से कोई इंस्टाग्राम पे भी मुझे फॉलो करते हैं, इंस्टाग्राम इज वेयर देयर आर शॉर्टर वीडियोस, बहुत फास्ट होता है, डिटेल्ड नहीं होते हैं. यूट्यूब में वी हैव दैट एडवांटेज दैट लॉन्ग फॉर्म वीडियोस वेयर आई कैन गिव मच मोर डिटेल्ड गाइडेंस. डिस्पाइट दैट आई अंडरस्टैंड कि हमारे मोर देन 80 वीडियोस ऑफ वेरिकोज वेन्स के अवेलेबल है ऑन यूट्यूब, बट डिस्पाइट दैट आई सी द सेम क्वेश्चंस कमिंग फ्रॉम डिफरेंट पीपल, and it is difficult for anyone to keep a track of questions also. So the interesting announcement that I'll make for all of you is that we are coming up with two very interesting programs, all for those who want to take care of their vein health. We have started a webinar called as Varicose Veins Simplified. It's a simple 1 hour webinar in which I give the step-by-step approach of how to identify which stage of varicose veins problem you are, how to identify at which stage the problems are likely or which are the red flags for problems, and when you should consult a vascular surgeon, what are the real treatment methods which work, and most important, which are the control measures which you can do on your own, in your own house, at your convenience, to take care of your vein health. We'll be sharing the link for that webinar for this Sunday, that in my description of this video. Please have a look at that. And another is a program which is a very, very detailed program which it's more of a knowledge sharing to a very great level. So it's a pre-recorded course called as Varicose Veins Decoded. It's actually a full program जिसमें more than 4 hours of actual explanation which I'm giving, with practical tips, checklists, helpful guidebooks जो आप खुद अपने पास रख सकते हैं. You can keep it with you, and the whole thing related to varicose veins is available on that learning platform, जिसकी लिंक जो कोर्स ज्वाइन करते हैं उनको मिल सकती है. In which I start with understanding varicose veins. Why do varicose veins happen? What happens when the valves start leaking? Why oils and garlic or pastes or creams and patches do not really help in varicose veins. How we take care of a protocol which we've developed called as the SEE protocol, which is a combination of the right way to use stockings, the right exercises, and the right methods of elevation during your work, during the time that you're at home and at night. What are the practical ways जिसमें आप पूरा एलिवेशन को आप स्ट्रैटेजी बना के एक लाइफस्टाइल में चेंज ला सकते हैं. वी गिव यू 30 day and a 90 day plan which you can implement on your own. एंड ये पूरे कोर्स में देन वी हैव अ फुल 1.5 hour session on diet because we get a lot of questions about which diet to have for varicose veins, and that's a very common question. So we have our dietitian Samiksha who has a 1 hour session on how diet helps and how diet can even harm those who have vein problems. To add to that, we have a lot of exercise videos. Some of you may have seen our exercise videos, and we receive a lot of good comments from you all ki our exercise videos are helping you take care of your health, and I'm happy to say that. So we have built this course specifically जिसमें हम बहुत ही selected लोगों को ये diet, exercise, lifestyle, everything packed together with not just lectures. See, videos ऐसी चीज है, it is just one way thing. So video is one part of it. More than 4 hours of video knowledge into that. उसके साथ साथ important चीज ये है that we will have 4 live sessions per month, जिसमें I'll be doing sessions, our dietitian will do, our exercise therapist Honesh will also take sessions, and to those course participants, we will be sharing the exact protocol, exact diet plans, exercise schedules, कैसे करते हैं, and next week we can review them. So this is a full varicose veins decoded program, and जिनको सिर्फ थोड़ा knowledge चाहिए, who do not want to go too much into details, they can definitely attend our varicose veins simplified webinar जो हम Sundays को कर रहे हैं. We'll be doing it for a few Sundays because we get a lot of requests from you that is Sunday कोई busy है. So what we are trying to do is at least every week Sundays ko we are doing this webinar for a few weeks where I'll show the entire steps what I recommend for varicose veins, and do check out the link for both the courses in the description. Thank you so much. आप सब मुझे chat में लिख रहे हैं. I'll finish what I have to say and then I'll go through the chat. But remember that varicose veins में the information and misinformation का gap बहुत बड़ा है. And no matter what media you follow, whether it's Google, YouTube, Instagram, Facebook, you will see very contradictory evidence. You know, somebody shared with us a few videos that oils which are helping to cure varicose veins, herb hai, garlic paste hai, which cures varicose veins. But scientifically, as a vascular surgeon, we understand that varicose veins reason is not the skin, it is deep inside the vein in the valve, and that is why most of the surface treatments do not work for varicose veins. Another question which we often receive is that would veins go away with stockings? Because stockings is one very integral part of treating varicose veins, and stockings may there are a lot of misconceptions about the size, about the type, about how to wear it, which size to take, which length of stocking, which grade of stocking, which company of stocking. So many doubts regarding stockings, including the fact कि मॉर्निंग में पहने, नाइट में पहने, या you wear it while exercising or walking. So a lot of queries which many of you have shared with us and we've tried to answer in our comments wherever we can, but of late I'm finding difficult to answer all your queries. So I thought a webinar is a good way where I can interact directly and answer your queries there and there, because अभी हम देख रहे हैं कि YouTube में my message replies have really been delayed. उतना टाइम मैं नहीं निकाल पा रहा हूँ. I'll go on to a few chat questions which you have shared and sent here. So hello to all, and treatment only an operation. Well, if you attend the webinar, I really specify one very, very important fact. 70% of people with varicose vein problem do not need an operation. Not everybody who has a few varicose veins needs to undergo a surgery. So although I'm a vascular surgeon और मैं बहुत surgeries करता हूँ, but I still believe that surgery is reserved for the 30% of people जिनमें शायद complications का risk ज़्यादा है और they have already started developing complications. So please, if you have the slightest of doubt whether you will need a surgery or not, do attend the webinar where I explain this in detail with statistics. Wood pressed oils, yes, that is also a good thing to have, and our dietitian covers that in great detail in our decoded course. Thank you so much for recommending me. Namaste, everyone. Yeah, Manju, it's good you've taken a lymphopress. You will benefit by it. Lymphopress is a wonderful way to really reduce the swelling because whenever you develop swelling in the legs and only exercise and elevation is not helping, lymphopress is a good option and a good support thing also. But do follow it up with stockings. So, see, Rohit, starting stage of varicose vein is where the conservative treatment methods really works well. The veins will not go away. Some ask me that if I follow your SEE protocol, will my veins go away? And my clear answer is no. But you can control it to a very great extent. Control it so that it doesn't trouble you. Visible veins may stay, but the problem due to veins will definitely reduce. Problems like tiredness, heavy legs, कुछ लोगों को लगता है पूरे दिन काम करके शाम तक पैर थक जाते हैं, ये जो थकावट वाली चीज है that also reduces to a very great extent. Those of you who have tried out our exercises and whatever protocols we are setting and giving would be really happy to see that exercise, stockings, and elevation, the SEE protocol, which I teach in great detail in my course, has helped so many of you. So thank you so much that, definitely you're welcome to join the webinar and the course also. So for uh, yeah, I have been active on social media thanks to viewers like you because I was interestingly I started social media because I was asked by few of our patients. They brought me videos of garlic being used for varicose veins. That this is what is coming up when they search for the right treatment for varicose veins. So the right treatment by the right specialist available itna nahi hai on YouTube. So that's where I fit in, and I'm happy to share that we have more than 600 videos on YouTube, which doesn't cost you anything at all, and you all can benefit from it. But specific details is what I teach in my course because YouTube restrictions do not allow me to show certain images or give specific medical advice. Yeah, so leg elevation. See, elevation stockings are ways to control varicose veins. They never cause regression of the veins, no matter what you do. So, the earlier you identify a vein problem, the better the outcome is. I am going through the comments, so I might have skipped a few. I'll just go through it. Well, when varicose vein ulcer is something which is the dreadful part. We teach in our course that how identifying whether your vein problem belongs to a stage 1 or a stage 6. Stage 1 is when there are very small veins, stage 6 is when there is an active ulcer. And stage 4 is when the skin starts becoming brown or black and starts getting pigmentation. So I always recommend that don't try to let the vein problem go beyond stage 4. Once an ulcer starts, no matter what treatment you do, the chances of the ulcer coming back remain high. Yes, when there's an ulcer, you have to go with a layered bandage for LBS you've written works well. And if required, getting the veins treated in time by either laser, glue, or sclerotherapy will help to reduce the chances of recurrence of an ulcer. Stocking size is something which different companies have different sizes. So you may have a size chart of that particular company and see if the size is much more, then maybe a customized stocking, or using a lympha press, reducing the stocking, and then wearing the stocking makes sense. मेडिसिन फॉर वेरिकोज वेन्स, वेल, मेडिसिन्स का रोल वेरिकोज वेन में बहुत लिमिटेड है, एंड वी डू यूज माइक्रो फ्लेवेनॉइड्स. there are number of trade names available which I won't name it here, but number of microflavonoids which are effective in improving the vein tone and microcirculation. But again, medicines will not cure your vein problem. We use medicines as a supportive treatment along with stockings, elevation, and exercise. And to all my patients, I always recommend that remember the priority. Number one priority is stockings, number two is exercise, number three is elevation, and then fourth number comes medicine, and fifth comes diet. So remember this sequence of importance that you must know. Something only taking medicine and not doing the rest, and they don't benefit because they do not follow the exact steps that I teach in my webinar. Exercise, we have a lot of videos. You can go through my YouTube for videos, and where we teach a lot of exercise. Yeah, so Deepika will share the link of the webinar too in after this YouTube live is over. I'll share the link for both. The webinar, just to give again an idea for those who joined in late, because I'm seeing that a few of you have just joined in. Uh, the webinar is a paid webinar at 299 rupees, where I give 1 full hour of a structured program for improving your vein health and taking control of your veins. As a doctor, I know some of you who have met me, 10 minutes of consultation is what I am able to give. And I cannot give 1 hour to everybody who meets me, even in my consulting room on a personal basis. But for a webinar, because of the size of a webinar and the method, I'll be able to give 1 full hour of detailed explanation of the steps that are required to control your vein health. So please do attend our Varicose Veins Simplified webinar. That's a 1 hour webinar. Some have even asked me that, so what's the difference between your webinar and a course? See, webinar is a live interaction, the way that we are doing this YouTube live, but I present specific slides and we share certain deliverables, certain red flag and stocking checklists with you, which you can keep with you. And the presentation, I guide you through the entire process of understanding vein problems, what control factors, how the SEE protocol should be done, what are the recent or modern treatment methods that we offer, what are the results of treatment methods that we offer. So it's a short, I would say, summary of the entire 1 hour detailed information about varicose veins treatment in the modern era. Whereas the varicose veins decoded course, it's actually a course. By a course, I mean it's not a one time thing. That is something which stays with you forever. Once you purchase the whole course, you get up to 4 hours of video content from me, topics ranging from why varicose happens, pregnancy and varicose veins in women is another very important thing which we get a lot of inquiries from you, that प्रेग्नेंट हुए और वेरिकोज वेन हुआ, या प्रेगनेंसी के वक्त हम क्या ध्यान रखें कि वेन प्रॉब्लम इंक्रीज नहीं हो. We receive a lot of queries about stockings, which we explain in detail. We have a 21-day pain relief program where we tell you इस week में ये करना है, next week में ये. And to add to it, we give you the modern treatment methods outlined with a few result videos and photos, which I cannot share here. We even show you the video of how the vein treatment is done. That all is pre-recorded, and you can hear that every time you want or you want to refer back. So the access to that course is something जो आपके पास रहेगा, and you can listen to the video as many times as you want. go back to another video, you find everything in one place. YouTube में होता क्या है, because YouTube has so much of information, so you saw one video, now to search another video it becomes difficult. Whereas in the course, it's a program, so that one after the other, module wise, we have a total of 7 modules in which I teach each steps. Two of the modules are taken by my team members. So Samiksha, our dietitian, will give you 1 full hour of entire information of the diet. Honesh, our exercise therapist, will discuss in detail and also show how the exercises are done. So you will be able to have everything you need for your varicose veins health within that program. And apart from the recorded videos, which you can keep referring, we will also have 4 live workshops where specific things where to those select people जिन्होंने decoded program लिया है, we will have a live interaction where I'll be able to take your queries and answer specific queries, because knowledge एक चीज है, you have heard something which I have said, but despite that you might have some specific doubts or problems which you want answered. So 4 hours of recorded content, which you can go through anytime you want, as many times as you want, with 4 to 5 hours of live workshop or interaction with me and my team, where we answer your queries. So if you see that the time given is going to be quite good, and इतना detailed information varicose veins के लिए आपको कहीं और मिलना शायद possible ही नहीं है. And yes, many of you will need to undergo a surgery, will need to undergo a treatment. Do that in time. Learn to identify the red flags, skin pigmentation, an ulcer, a bleeding, are red flags. If you have any of these problems, try to consult a vascular surgeon and get them treated in time. Don't wait for the complications to increase further, because even though science has advanced to a great level, modern treatments है अभी quite safe, recovery is good, but और कोई मेडिकल ट्रीटमेंट या any of the herbal remedies, natural remedies cannot cure varicose veins. So please, अगर आपको कोई डॉक्टर vascular surgeon treatment recommend करते हैं, we even have a treatment roadmap in our course where we give you a step by step guidance about if you have this, you belong to this stage. See your Doppler report, assess your Doppler report, find out what stage you are in and what would be the likely treatment required for you. Standing or sitting, both are problems for so many of us. So many of us have to be either standing for long hours, sitting for long hours. That's what I teach in my workshop. What to do if you're sitting, what to do if you're at your desk whole day, or again, what to do if you have to be standing whole day. How do you really ensure that the standing does not end up damaging your veins? The webinar is on Sunday. We'll share the link so that will have all the further details. It's on this Sunday at 4 p.m. Stocking size is something which will depend on the size of your leg. So the ankle and calf circumference is what is required. And depending on that size of your ankle and calf, you'll have to check it with the stocking list. Every company has their own size list. So it will depend on what your measurement is. Yeah, so that is one problem that happens, that when varicose veins advances, the skin starts becoming black, thick, and rough, and it is very highly prone to ulcer. So you must consider showing to a vascular surgeon and get the veins fixed or treated. DVT is a very separate problem, closely linked to vein health, but yes, DVT is something that we treat, and we do give some advice about how to prevent DVT, because those of you who have varicose vein problem are at a very high risk of developing DVT. So you must know what are the steps that you must take to really prevent DVT happening. And when DVT happens, treating DVT is very important, and that too in time, because the major problem with DVT is when a clot from your leg goes up into the heart or the lungs. That can be really fatal. We call it as pulmonary embolism, and that can be really deadly. So, DVT, if there is sudden swelling of one leg, without any other history also. Think of DVT, get a color Doppler, show to a vascular surgeon. Don't wait for a video to give you that diagnosis. Yes, stockings are helpful for DVT as well. Customized stockings, I think when you get the lympha press, they also would be able to guide you for the customized stockings. Varicose veins treatment, there are multiple treatment options which we really go through in quite detail, because it's the treatment itself. The entire explanation about treatment ranges to almost 40 minutes to just explain step by step what we do. And yes, ulcers can recur even after treatment, because once the skin is damaged, that's the reason I always say that try to get the veins treated in time before an ulcer forms. Because if you wait for an ulcer to form, even after treatment, the chances of ulcer coming back remain very high. Surgery method for, if you're not affording for it, see, many civil hospitals do offer varicose veins surgery, and surgery is not a bad option. Surgery means ki cut rakh ke vein ko nikalna was the standard treatment for so many years. It has now been overshadowed by minimally invasive methods, क्योंकि लेजर है, आरएफ है, ग्लू है, स्क्लेरोथेरेपी है, डिफरेंट मेथड्स जो हम यूज करते हैं, वी डोंट हैव टू रियली पुट कट्स एंड स्टिचेस, एंड इसकी वजह से ही आपका ओवरऑल रिकवरी पीरियड फास्ट है. इट does become a little expensive because of the equipments to be used, but despite that, results or recovery as compared to open surgery अच्छी है, and that is why many of you really opt कि हम थोड़ा वेट करके करेंगे, बिकॉज वेरिकोज वेन्स में यूजुअली कोई ट्रीटमेंट की इमरजेंसी नहीं होती है. इमरजेंसी ओनली हैपन्स फॉर टू थिंग्स. वन इज दैट वेन बर्स्ट होके ब्लीडिंग हुई हो, या फिर वहां पैर में आपको अल्सर या जख्म हुआ है. दीज आर द टू इंडिकेशंस व्हिच बिकम इमरजेंसी. Otherwise, varicose veins treatment is usually not an emergency. Neuropathy and muscle weakness is something which I do not treat, because I'm a vascular surgeon. I treat problems of the arteries and veins. Neuropathy is something which a neurologist can treat. So that is something which a neurologist would be able to help you with that. So compression stockings, we'll share a link in this video itself where you can check out the link, and we have a discount code in my name. If you buy from that link and you write Dr. Sumit Kapadia, you'll get a 20% discount on that stocking. Do check out the size yourself, because if a wrong size comes, I don't know whether they'll return it or not. So before you buy it, make sure you check your size and their size chart, and then buy the stockings. I usually recommend a below knee stockings, because that is sufficient for most of us. And the same stockings which are used for varicose veins will also be useful for someone who has had DVT. So DVT doesn't have different stocking grades. Both are class 2 stockings that we recommend. So varicose veins starts from deep and then shows on the surface. So it never goes from out to in. Reflux means there is reverse of flow, and वेरिकोस का स्टार्टिंग पॉइंट ही अंदर वेन के वाल्व में से है. वाल्व लीक होता है, ब्लड भरता है, वहां जाके वेन फूलती है, देन इट कम्स ऑन द सरफेस. Surgery can cure varicose veins for sure, but we call it as a near permanent treatment. Near permanent क्यों है? Because despite the best of the treatment, whether it is surgery, laser or glue, 10 to 15% people will have new veins coming up. But किसको आएगी, कब आएगी, कितनी आएगी, कहाँ आएगी, we do not have any way to predict that. So despite the best of modern treatments, chances of recurrence remain. So if anybody says that there's 100% guarantee for this treatment, I don't think that is really a true statement. So beware of such 100% claims for anything in life. So skin has become dark. That is a reason that you should get the veins treated. Once your skin problem has started, that means that the vein disease is now at an advanced level. So consider getting the treatment done in time. Don't wait for an ulcer. For the webinar, because it's a live thing on a different platform, we do it on a Zoom, so recording is not available, but we'll be doing it on the next Sunday also, because I know we've got many inquiries. We had one webinar last week and we got 30 inquiries that when is the next webinar, because I was busy, I was unable to attend. And that's why this time we've kept a different time zone, but maybe the next Sunday we will go ahead and uh, do it in the morning. After surgery, the recovery is fairly fast and simple. So, usually, if it's a one leg surgery done, that's a 1 day of stay, and the next day you can be walking. And in 3 to 4 days, you can resume your routine activities. Exercising, we usually advise to avoid for a month. Expenses of surgery will depend on what procedure is required for that specific problem, because in our webinar I show you how when we say varicose veins, it can range not just from stages but from the size of the vein. The difference is huge, ranging from the smallest of spider veins to the largest of varicose veins, which can be more than 1 or 2 centimeters big. Spider veins will be those which are not even 1 millimeter small. So the entire treatment will depend on the exact extent of varicose veins. So there cannot be one figure to the expenses, but to just give you a rough idea, usually one leg treatment would range somewhere between 60,000 to 1.2 lakh, depending on hospital or the clinical condition you are in. Glue or vena seal becomes a little more expensive because glue is a newer treatment and the cost of the consumable is almost 1 lakh. So if we do a glue, then the surgery cost increases to almost 1.5 to 2 lakh rupees for a leg. If one leg has swollen up due to DVT, don't apply hot compresses. Get yourself tested. And garam pani ki baat karu to I'll again give you a very very important message here. Have varicose veins, and if you have smaller but very very prominent veins, skin के बिल्कुल बाहर आ गई है near your foot and ankle, do not do hot water compress or hot water soaking. आज ही एक पेशेंट हमारे पास आए कि पैर दर्द था, तो उन्होंने कोई वीडियो में देखा दैट गर्म पानी में एप्सम सॉल्ट डाल के सोक करने से वेन्स गायब हो जाएगी, एंड शी डेवलप ब्लीडिंग, द वेन बर्स्ट, it bled, and we had to admit her. So if you have varicose veins which are bulging enough above the skin surface, तो हॉट वाटर अवॉइड करना है. हीट से वेन्स डायलेट होती है. ट्राई एंड यूज अ कोल्ड कंप्रेस और आइस. आइस और कोल्ड टेम्परेचर से वेन्स श्रिंक होती है टेम्परली. इट्स नॉट कि कोल्ड करने से वेन्स गायब हो जाएगी. टेम्परली दे विल रिड्यूस इन साइज. सो ट्राई टू अवॉइड हॉट वाटर if you have a larger varicose veins. I think we will have 5 more minutes to go. Next Sunday, definitely, you're most more than welcome. Did I miss any questions here? I see a lot of questions have come up. Okay, okay, okay. Medicine. Exercises, we have a separate video for exercise. It's essentially exercise के दो purpose है. One is to activate the calf muscle pump. So calf muscle pump को हम second heart कहते हैं, and that helps to activate the blood, push it from the foot towards the heart. So इसीलिए वो second heart जैसा काम करता है. So exercise का first rule is to activate the calf muscle. The second rule is to do elevation of the leg, जिससे आपका gravity guided return आएगा. And exercise में there are a lot of small specific tips जो पूरा हम webinar में and हमारे course में सिखाते हैं. We also have a lot of PDF downloads, because कुछ लोगों को आदत है कि एक बार वीडियो में आपने सुन लिया, देख लिया, and then you want to revise it or maybe keep a printout of certain things with you. So in the course, we have designed specific checklists, treatment roadmap, diet plans, जो आप खुद print करके you can keep them in your home so that you can refer to that as many times as you want. My hospital is based in Vadodara, Gujarat at Adikira Hospital. So that's where I'm located. And I do not visit Mumbai or Bangalore because many of you have asked me कि आप दिल्ली कब आ रहे हो और Bangalore कब आ रहे हैं. But you are welcome to see me at Baroda if the need arises. Dobecil or any of the flavonoids have a limited role to play. They usually help to improve the tone of the veins. So, if someone has swelling, heaviness, or cramps, then it can be really used for that. Ulcer is coming back means that either you have veins coming back, or you have a deep vein problem, or maybe your compression is not sufficient enough. So if after treatment the ulcers are coming back, rule out some other new veins which have come up. So sometimes repeat treatment may be required if ulcer is coming back. Leg elevation as much as you can. There are specific ways of doing elevation. It's different when you're sitting, it's different when you're standing whole day, it's different at office, at workplace where you cannot keep them on the table. And there's a different elevation angle which you should maintain at night. Kolkata, yeah, maybe we'll have, meet you all somewhere. So I think I have said what I really wanted to. I just wanted to share that the detailed courses that I have been introducing, which I wanted to tell you all about. And we'll be sharing a lot of information about our webinar on my YouTube and Instagram as well. So please do stay connected and keep writing your comments. Although I don't promise मैं सबके comments को answer कर सकता हूँ. I have been very regular at answering comments for quite some time, but अभी थोड़ा course में and overall we remain busy and comments भी बहुत ज़्यादा बढ़ गई है. So कई बार I read through it, but I'm unable to answer some questions or comments. So forgive me for that. It's not intentional, but we try to answer as many queries as we can. एंड अगर एक क्वेरी आप लिखते हैं, डोंट राइट इट रिपीटेडली इन द सेम वीडियो. सो इफ you write a comment on our video, see another video which might answer your queries. So if any of you really goes through my YouTube channel, we have more than 80 videos on varicose veins alone. So बहुत सारी queries तो वहाँ खत्म हो जाती है. और detailed queries है, that is where a webinar will be very helpful, क्योंकि in the webinar and the course you get everything at one place. YouTube की तरह आपको बार बार एक वीडियो से दूसरे पे घूमने की जरूरत नहीं पड़ेगी. या वेन्स कैन हैपन एनीवेयर इन द लेग्स. किसी ने मुझे पूछा है कि वेन्स हाथ में होती है. नहीं, हाथ में वेन्स होना बहुत रेयर है. यूजुअली इट्स द लेग बिकॉज वेरिकोज वेन्स इज द प्राइस वी आर पेइंग फॉर standing on our two legs, because when we stand the entire blood of the leg is under pressure. So muscles help to push the blood up and the valves make sure that the blood doesn't come back. But valve leak hota hai, that is when the whole problem of varicose veins starts. So I think if all is okay, then we will go off this live. Any more questions? I'll take two more questions if there are, and maybe I'll meet you on Sunday in my Varicose Veins Simplified webinar. I'll share the link of the webinar and the Varicose Veins Decoded. The name of the full course is Varicose Veins Decoded. Anybody interested, please go through the details which we have written there and you can decide on that. So I think thank you all for joining me, and we'll keep connected through YouTube, Instagram, and through our webinars. So, and do keep commenting on my videos because we'll try to answer queries there, specific queries. If someone wants an online consultation, we do have the link in the description that you can refer to. We do online consultation. Many of you have either visited me, got treated through me, or even done on online consultation, because I understand that traveling from one city to Vadodara may not every time be possible. But the purpose of a course is that so many of you will be able to take the course, learn what is required, and not even need a vascular surgeon. So imagine taking control of your problem by yourself. That's what my aim is. And my aim is to make sure that I help more than 1 lakh people improve their vein health. And you all are part of that. So I wish you all the very best and see you the next time. Bye, everyone.